And tonight we'll begin from Parliament, where the Health Minister, Kwame Menu, has backed the demand by the minority for a comprehensive audit into all COVID-19 expenditure. This follows a motion by the minority for the House to probe the expenditure that accrued as a result of the pandemic, contributing to the budget debate. Ranking on the Health Committee, Kwame Menu insisted that his side of the House will push thorough with the probe. He also accused the government of failing to make available funds for the construction of the Agenda 111 hospitals in the 2022 budget, describing the policy document as lacking credibility. In the view of the Joboso MP, the current administration must complete the existing health facilities before initiating new ones.
And let me serve notice that during the estimates at the committee level, we will insist on the details of the COVID expenditure. Mr. Speaker, again, the Mahama administration left and invested hugely in the infrastructure in the health sector. Without imposing e-transaction levy. Mr. Speaker, per Article 35(7) of the 1992 Constitution, governments are enjoined to continue to complete and operationalize any project that they inherit. Mr. Speaker, again, any document that worth the sort of a budget must give the progress so far on all these projects. Mr. Speaker, what is the status of Afari Military Hospital? It is missing in this budget.
Ask them.
Mr. Speaker, what is the status of Kumawu District Hospital? It is missing in this budget.
Ask them.
Mr. Speaker, what is the status of Abetifi District Hospital? It is missing in this budget. Mr. Speaker, what is the status of Famila District Hospital? Mr. Speaker, it's missing in this budget. Have you given them the money, the contractors the money to go back to site? Mr. Speaker, especially with that of Abetifi District Hospital, the sad story is that if we have to go back to the site to continue that project, Mr. Speaker, we will have to demolish not less than 70% of the structures on site. Mr. Speaker, the obvious question is it not causing financial loss to the state?
It is.
Mr. Speaker, I think that at this point in time, we should compel the executive to demonstrate sources of funding to some of these projects, to complete them, and to operationalize them before seeking for more. Mr. Speaker, I said that is not enough. They moved from 88 district hospitals to now Agenda 111 without demonstrating clearly in this budget where they are going to get the sources of funding. You promise you bring them in budget before going to look for funding. Who does this, Mr. Speaker? Mr. Speaker, again, I don't think, because the dishonesty in this budget is too much, Mr. Speaker, I don't think that this document qualifies to be a budget for the Republic of Ghana.
The Health Minister, Kwame Menu, welcomed the probe and added that government will struggle to fund the construction of the health infrastructure, including Agenda 111, if it fails to raise the needed revenue.
How it happened. Almost all banks in this country were going broke by the end of 2016. If you had entered 2017 without change of government, Mr. Speaker, I'm afraid some of us will have signed checks without laying hands onto our deposits that were put into the banking system. Here, they wouldn't read what Secretary said, IMF told you. Financial sector reforms should have started as far back as 2013-2014, where most banks were not even meeting their capital adequacy ratio. Yet we couldn't do anything. Then we come in 2017, just like we managed HIPIC, to come and resolve financial sector, put reforms in there to clear the mess. At the end of the day, the cost to this country is part of the debt burden that we are now entertaining. The energy sector, IPP challenges, litigation and some compensation to some people to just get them off, to make sure that we will kill them off, which we have actually done. That is part of our debt burden. Mr. Speaker, apart from these mess that we inherited, there are several others, and I'll continue. The new initiatives that we started, who has costed senior high school costs, school feeding costs, All these things have been borne by the government, by the states, without people paying for anything. Mr. Speaker, let me go to growth. We have soon forgotten about the impact of COVID on all of us, even including Parliament. For several months, we were in lockdown. We wouldn't come to the chamber. When 3 people come today, 4 people should come tomorrow. How could that have contributed to any magnificent growth in any economy? Not only here in Parliament, the banking system. Up to today, have go to work 2 weeks, the following week they don't come again. Lock-up of Kumasi and Accra, the economic nerve centers of our country, against the other parts of the country. For nearly 2 months, 9 months, 10 months, how could that generate growth into our system? Yet, you were doing better growth than when NDC exited exited government. Mr. Speaker, these are some of the things that all of us here should think about passionately.